You're listening to the Quint podcast.
After 3 consecutive days of reporting the highest peaks in fresh cases, Delhi overtook Tamil Nadu on Sunday to become the second worst coronavirus-affected state in the country. In just the past 1 week, between 15 to 21st June, the capital reported more than 18,000 new cases of infections. But apart from the number of infections, what have also made the situation in Delhi quite concerning is firstly, a high growth rate of infection, and secondly, the spike in the number of deaths. A flurry of meetings took place between the centre and the state to revamp Delhi's COVID planning after the Supreme Court criticised Delhi and some other states as well earlier this month over their handling of the pandemic. But why is Delhi faring so badly in tackling the crisis? And what are the new strategies ahead? For this podcast, we spoke to Dr. Sumit Ray, a critical care specialist in Delhi NCR. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you. And I'm your host, Shorbari. India reported nearly 15,000 new coronavirus cases in the last 24 hours, taking the total tally to over 4,26,900 on 22nd June. Over the last 1 week too, the country saw consecutive peaks for 4 days straight starting since 18th June, and the top 3 contributors to the overall spike have been Delhi, Maharashtra and Tamil Nadu, which are also the states with the highest number of infections. While all the 3 states have been battling the infection rates in their own way along with dealing with the crisis in the health sector, unlike Maharashtra and Tamil Nadu, Delhi has been reporting a higher rate of infection and also more deaths. If you take the case of Mumbai, it's the worst affected place in Maharashtra and is fast heading towards the 70,000th mark. Yet the good news there is that the initial 12% transmission rate, which translated into a doubling period of 18 days, was reduced to 1.02% in June. In comparison, Delhi has been growing at 5.52% and may soon even come close to Mumbai with its infections. And the second concern in Delhi is that although set apart from Tamil Nadu by a few hundreds in the number of active cases, Delhi has reported close to 3 times the number of deaths than Tamil Nadu. While with over 59,000 cases, Tamil Nadu reported 757 deaths. Delhi, on the other hand, reported 2,157 deaths so far. So what explains these numbers? I called up Dr. Sumit Ray, a critical care specialist in Delhi NCR, to understand the situation in the capital.
The growth rate for Delhi in terms of cases over Mumbai is higher, also because the denominator probably is lower. In the sense, the number of the growth rate as a percentage is dependent on the denominator and the numerator. So if you have 50,000 cases at baseline and today the cases increase by 2,000, so the growth rate is 4%. And if your baseline is that you have 40,000 cases and the number of cases have increased by 2,000, then your growth rate is 5%. So the growth rate is dependent also on the denominator of how many cases you have at baseline. So Maharashtra has a higher baseline, or Mumbai has a higher baseline, so it may be showing a less growth rate. Yes, the number of cases probably are stabilizing a little more in Mumbai as compared to Delhi. That could be multiple factors, good, better public health management of cases. That could be helping. Second is the possibility which some people, epidemiologists, have said, and I have also said about, is that heat and humidity of the moisture of the monsoons coming down in Mumbai could be a factor. We don't know. Delhi hasn't been hit by the monsoon yet. There could be multiple reasons why the death rate in Tamil Nadu is much lower than that of Delhi. One is Tamil Nadu is testing at much higher rates than Delhi, so they pick up many more milder symptomatic cases and asymptomatic cases, and that leads to again an increase in the denominator, which shows a lower percentage of death.
And speaking of testing, even though Delhi has had the total capacity of conducting 8,600 tests per day, in the first few weeks of June, the daily average of samples tested was half, around 4,800. There also have been reports of tests and test results getting delayed as well, patients being turned away from hospitals, And in a previous episode of The Big Story, we had also covered the hospital bed crisis in the city and what led to it. You can check it out on our show notes. But the situation hasn't changed significantly. Another recent ground report by the Quint from 17th June at Delhi's GTB hospital found out that people were still waiting for tests and running between hospitals. Listen to their ordeal as they talk about waiting outside hospital for tests.
क्या हो गया इन्हें?
सांस लेने में दिक्कत हो रही है।
टेस्ट हो गया?
नहीं, वो बोल रहे
टेस्ट भी नहीं कर रहे?
नहीं, कुछ पता ही नहीं लग रहा। पीछे दूसरा मेंटल हॉस्पिटल है ना, उसमें यहाँ पे
एक दूसरे की हंसी भी उड़ा रहे हैं यहाँ पे, इसलिए हंसी उड़ा रहे हैं कि देख ही नहीं रहे कि भाई ये पेशेंट किस लिए है, आप बाहर बैठिए, आप वेट करिए। ऐसे नहीं होने चाहिए यहाँ पे। पेशेंट को हमेशा तसल्ली दिलानी चाहिए कि हाँ भाई हम आपके साथ खड़े हैं। मेरी मदर है, उनको परेशानी ये हो रही थी, सांस में प्रॉब्लम हो रही थी और हाथ पैरों में दर्द हो रहा था। जो ESI हॉस्पिटल में गए थे, उन्होंने रेफ़र कर दिया, GTB ले जाइए, इसलिए बहुत परेशान हो रहे हैं, बैठे हैं, इसलिए कब तक रिपोर्ट देंगे, कब तक नहीं देंगे। अभी तो टेस्ट कर रहेंगे, हम बताएंगे, आप बाहर बैठ जाइए थोड़ी देर, हम बुलाएंगे।
उनके साथ और भी पेशेंट हैं?
और भी पेशेंट हैं, और क्या पता उनको है भी नहीं है, तो हम चाहते हैं क्या उनकी वजह से उनको ना हो जाए, डर लग रहा है।
अभी उनका टेस्ट करा दिया है कोरोना का, कह रहे रिपोर्ट 3 दिन बाद आएगी, उसके बाद ही हम कुछ बता पाएंगे।
मेरे जीजा को सांस की दिक्कत थी, आ रहे जांच की और हल्की खांसी आ रही। रिपोर्ट में अभी कल से कुछ बताया नहीं डॉक्टर साहब, क्या है नहीं है, कुछ नहीं बताया अभी तक। वहाँ पे जाते मिलने देते नहीं है, डॉक्टर साहब भगा देते वहाँ पे।
तो रिपोर्ट कब तक आने का बता रहे हैं?
रिपोर्ट 4-5 दिन बाद बता रहे हैं।
And this problem has been persisting for a while now in Delhi because of a number of reasons, and the matter has even been taken up to the High Court. Firstly, private labs have been facing a manpower shortage to carry out the process of uploading data on the several different platforms like the RT-PCR app, the COVID app, the ICMR portal, and the integrated surveillance portal linked to the office of the Chief Minister. Secondly, in some instances of non-COVID-19 patients needing urgent treatment or surgeries who have been asked to undergo a COVID-19 testing first, couldn't do so because the hospital in concern wasn't given permissions by the Delhi government to conduct the test. Thirdly, on 2nd June, the Delhi government's health department had also decided to exclude asymptomatic or pre-symptomatic patients from COVID-19 testing, following which some labs were also barred from testing after flouting the norms and going ahead and testing asymptomatic patients. That decision was later reversed by the Lieutenant Governor Anil Baijal. But as these prevailing circumstances in the capital drew sharp criticism from the courts and allegations of fudging the infection numbers and deaths were brought up by the centre, the state and the Lieutenant Governor locked horns that in some instances have led to taking decisions without actually taking proper stock of the situation. Take, for instance, the order from the Lieutenant Governor Anil Baijal enforcing mandatory institutional quarantining of 5 days for COVID-19 patients. After a stiff protest from the Delhi government, that decision was altered the very next day, but as per the new directive in place, COVID-positive people will now have to visit the COVID care centres for health assessment to decide whether they'll be needing home isolation or institutional quarantining. But will this move help without addressing the shortage of government and private ambulances? Back to Dr. Ray here.
Unfortunately for Delhi, there has been a lot of back and forth in decision making about how to treat the mild cases or asymptomatic cases. Should they be hospitalized or in quarantine, in government quarantine, etc. And that has led to a lot of confusion, and that obviously makes it difficult for continuation in decision making and understanding what to do. People get confused with these back and forths. And the LG's order about requiring COVID positive people to visit COVID care centers for health assessment to decide whether isolation or institutional quarantine is required or not. Well, on one hand, it may seem good because then you are very sure that somebody who cannot get good quality isolation in their home to isolate themselves from the rest of the family gets a real picture of is it possible for them to do it or go to a government quarantine center. But that has caused two sets of problems. One is the lack of ambulance to transfer patients, etc., transport these patients. And second is that, a lot of people may avoid going to these centers and getting themselves checked up there to decide because they may not like to be quarantined in outside their homes. So it's a double-edged sword, and it's a difficult decision to make.
But that being said, after days of initial discord from the centre's intervention, the Delhi government and the centre have decided to keep their differences aside and work together in this crisis. They've also come up with a fresh set of plans to arrest the transmission rate in Delhi. To begin with, the last few days saw an increased capacity of testing, 3 times more than it was in the initial weeks of June, close to 18,000 tests per day, which is higher than the national average too. Delhi also became the first state to begin rapid antigen testing in containment zones. Currently, there are 193 centres where antigen tests are being conducted. And according to information shared by the Deputy Chief Minister Manish Sisodia, the city had conducted 19,720 rapid antigen tests and detected a total of 1,407 positive cases on 18th and 19th June. In a press conference, Delhi Chief Minister Arvind Kejriwal also informed that patients in home isolation will be provided with oxygen concentrators and oximeters so that in cases of emergencies, they can be stabilized at home first before being taken to a hospital.
केंद्र सरकार की मदद से दिल्ली में एंटीजन टेस्ट भी शुरू किए गए हैं। एंटीजन टेस्ट रैपिड टेस्ट होता है, 15 मिनट में, आधे घंटे में पता चल जाता है। तो इस टाइम दिल्ली के अंदर लगभग 18,000 टेस्ट डेली हो रहे हैं। मैं समझता हूं कि अब आपको अपनी टेस्टिंग कराने में कोई दिक्कत नहीं आएगी। जिन लोगों का इलाज हम घर पे करते हैं, जो लोग माइल्ड होते हैं, कम बुखार है, थोड़ी सी खांसी है या कोई सिम्टम नहीं है, ऐसे लोगों का इलाज उनके घर में ही रह के किया जाता है। उसमें हम डेली हमारी टीम उनको फोन करती है, उनसे हालचाल पूछती है।
With the help of the centre, Delhi has begun conducting the rapid antigen testing that shows results within 15 to 30 minutes. Delhi is conducting close to 18,000 tests per day. I hope you won't face any more difficulties in getting tested. Those who are being treated at home, those who are asymptomatic or showing mild symptoms, they are being regularly contacted by government officials who are advising them about the next steps. But with coronavirus, the biggest concern is the dip of oxygen levels that induces breathlessness. If patients can be provided with oxygen sooner, then we can save more lives. So, we'll be providing oximeters to those who are home quarantined. Patients can keep the pulse meters at home and monitor their oxygen levels and then return it to the government after they are cured. If a patient's oxygen levels dip, they can contact government authorities. Every district has been provided with oxygen concentrators that will be delivered at the home of the patients who need it so that they can be stabilized at home before being shifted to a hospital.
और आपको तुरंत आपके घर में ऑक्सीजन दे दी जाएगी और अगर जरूरत पड़ेगी तो आपको अस्पताल में शिफ्ट कर दिया जाएगा। कई बार हमने देखा है कि ऑक्सीजन तुरंत न मिलने की वजह से अस्पताल में शिफ्ट करने तक इतने में ही कई बार मरीज कभी कभी कोलैप्स कर जाता है। तो इसीलिए हर डिस्ट्रिक्ट के लेवल पे हम लोग ऑक्सीजन के कॉन्सेंट्रेटर रख रहे हैं और अगर आपको जरूरत पड़ेगी तो कॉन्सेंट्रेटर पहले तुरंत आपके घर पहुंचा दिया जाएगा ताकि आपको समय पे ऑक्सीजन मिल सके और आपको कंट्रोल किया जा सके। फिर आपको अस्पताल ले जाएंगे और अस्पताल में आपका इलाज किया जाएगा।
Under the MHA directive, some other new plans going forward will be the rejigging of containment zones with a fixed deadline in mind, like recharting all the containment zones afresh by June 26th, conducting a full survey in these containment zones by June 30th, and then doing a large-scale serological survey in the rest of the capital by July 7th. The MHA has also instructed the Delhi government to assess every single COVID death starting from home isolation to when the patient reached the hospital and from where, and report it back to the centre. Whether or not these strategies will help Delhi recover is something they'll be left to see. If you like listening to this episode, please subscribe to the Big Story playlist for episodic updates. We're live on Apple, Google Podcast, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website and check out the podcast section. For any feedback, shoot an email to podcasts@thequint.com.
Thanks for listening. Log on to the Quint website and check out our other podcasts.